morning, everyone. My name is Dr. Kenny Stein. I'm a critical care physician, emergency medicine physician, and internal medicine physician. And today we're going to be talking about the standard of care 2025, how the standard of care relates to causation. My contact information is here. Please feel free to contact me after the presentation if you have any questions. When I'm presenting a case to a jury, to a lawyer, or if I'm discussing a patient's care with a patient or her family, the important concepts I try to keep in mind is if you can't explain it simply, you don't understand it well enough. It doesn't matter how knowledgeable you are if you can't get that information across to the people who need it. I've been an expert witness for 20 years, been a physician for 29 years. Much to my kids' chagrin, when I travel, I love taking travel photos, and a lot of times there are signs and of safety warnings. This one is warning you that if you're in Vienna, Austria, do not get drunk and walk by the edge of the river as it may be dangerous. To the best of my knowledge, I have no relevant financial relationships with ineligible companies that will significantly affect the views that on the topic I'm presenting today. Important disclaimer. I am not an attorney. I'm a physician with a lot of experience as an expert witness, but these are my viewpoints. I'm not an attorney. When I use the term physician, we can interchange that with a nurse practitioner or a physician's assistant. The new term for a physician's assistant is now physician's associate. And quickly, the learning objectives for today. We're going to go over the legal definition of the standard of care, at least in some states, and distinguish how that differs from the guidelines and what people consider gold standard care. Realizing that jurisdictions have different rules, the provider role will affect the standard of care and the specifics of that patient interaction. We're going to look at the relationship between the breach of the standard of care and causation. We're going to look at some real case examples, and we'll go over some areas where you might view that there may be pitfalls in an expert witness testimony or an opinion that's being given by an expert witness. As I'm sure most of the people in the audience here already know, there are four essential elements to a medical negligence case. One, there's a duty to treat. Two, there needs to be a breach of the standard of care. Three, there needs to be causation